Hi everyone, my name is Hannah and today I'm going to be performing a sterile central line dressing change. It is a sterile procedure, however, the first step of this procedure is to use clean gloves, not sterile gloves, to remove the old dressing on the patient. So first we will remove the old dressing. As I go to take off the old dressing, please also note that at this time I have clean gloves on and both myself and the patient are wearing a surgical mask. You may also ask your patient to turn their head away from the site. Next, I'm going to remove the old dressing. I'm going to stabilize the actual central line, pull up from the edges towards the center, now that's off. I'm going to remove the old BioPatch. I'd also like to point out at this time that pretend that this central line is secured with stitches, so we'd be cautious of that. And if the patient were to have multiple running lines with drips running, we would make sure to tape the lines before putting on the new dressing to decrease the risk of accidentally pulling the line out. And that is something that you may just verbalize during validation. We do not expect you to actually tape the central line. As we go to perform applying the new dressing, please note that I have changed into sterile gloves. I decided to use my own pack of sterile gloves, which you may do. Because of that, if there were to be sterile gloves in this kit, you would have to discard them by picking them up and just dropping them away from you. Before I begin this procedure, I am going to go over a few things about what is going to be contained in the kit. This is the chlorhexidine that you are going to use to clean. For simulation purposes, we are going to use the simulated swab stick. You only need to use one to represent the skin prep adhesive. This is the BioPatch, which I want to show you is in this little container. So this came in the kit, so this whole thing is sterile, so I can touch it with sterile gloves. However, some kits this does not come in the kit, and beforehand, while I had clean gloves on, I would have had to drop it in my kit like so. But because this is coming in the kit, I can touch the whole thing with sterile gloves, and everything in this kit is sterile. The dressing is going to be underneath everything. Okay, now we can begin. First, you are going to crack the chlorhexidine. You will hear a little crack if it's a new one. And then you are going to clean the site. The insertion site needs to be cleaned thoroughly. There may be some buildup on there that you want to get off, and the wet time should be 30 seconds. So that means it needs to stay wet for 30 seconds and you need to let it dry. You're going to scrub back and forth. And note that if I'm cleaning around the insertion site first, then I can move outwards. I never want to see you start outwards and then move back towards the insertion site like what I just did there would be incorrect because you could introduce bad germs into the insertion site. So then you're going to state that you would let this dry. And I never want to see anybody fan it. That is also not appropriate and it would contaminate it. Then I'm going to drop the chlorhexidine. I only need one swab because in the real packets it will just be one. And this is going to be the skin prep adhesive. And I want you to make sure that you create a nice outline for where your dressing is going to go. And you should also state that you would let this dry as well. Drop that. For the BioPatch, this is a real BioPatch, and you can see that there's wording on it that tells you which side to put up. The wording should face up, and you should have the split facing down. And all you're going to do is just tuck that at the insertion site. I'm going to do my dressing now. I do not have to be sterile. As you can see, I'm contaminating my hands, but that's okay. You can touch the skin now. And please note that there is this marking down here where you would write the date. Never write that on the actual patient. So now I'm not sterile. I would take a pen, I would write the date, and then I would add that to my dressing. And one more thing I just want to note is that I did not tape this mannequin down when I did this dressing change. But if you had a real patient and they had lines running, you would want to make sure that it was taped before putting this on. And then at this point, I would remove the extra tape that I put on just for stabilization, because this dressing is keeping it stabilized. And now you have completed your central line dressing change.